because we're approaching. Please mute this, please mute.
One from this part of the country, Nigeria, and good.
Your mic is muted.
Okay, good evening, everyone from this part of the country, Nigeria, and good afternoon, good morning to others in other country. I'm Ezeguchom. I'm here to moderate this section on mental health. So I'm so happy to have you all here. So, and I'm delighted to be honored in this call. So you guys relax and enjoy the call with me. I'll be calling in my first speaker, Mr. Idion Singh of Film. Sorry if I not pronounce that well. I'm so sorry. So, who is a public health advocate on mental health, and he will be taking us. He will be talking to us about mental health matters. So I believe that we all wants to know what mental health is about. So, Mr. Ifyom, you have the floor. Thank you.
Okay, good evening, everybody. Good evening, viewers from Facebook. Like she
Good
mentioned, my
evening.
name is Idon Opong, and I'm a public health advocate and also a volunteer in many other organizations. I don't only talk about mental health, but I talk about other aspects of individuals and society, including education and the rest. So today I'll be talking about mental health because not just because this month is about mental health awareness month, but because mental health is very important to our well-being. So, before we start, I would like to give a brief definition of health by World Health Organization. So, it is defined as a state of complete mental, physical, and social well-being of an individual, and not just merely the absence of disease or infirmity. So if you listen to that definition, you can see that mental health comes in there. So now we are going to also define mental health because it has its own definition. So mental health is defined as the mental well-being of an individual, whereby the individual to cope with the normal stresses of life, realize his or her abilities, learn well, work well, and then contribute positively to the productivity of this community. Now, from those two definitions, I think we can fully understand, we can get the glimpse of what mental health is all about. Now, without mental health, other aspects of health will be in jeopardy. Other aspects of health will not function. mental health is not a physical injury that you see. Maybe you have a cut on your finger, you have a cut on your leg, and maybe you try to band it, maybe to for it to heal. No, this one is not physical. You can't see it. That's why it's a bit difficult to. I see someone walking in the street, and then you know that maybe this person is down with a mental health
You know
condition.
they are seeing you.
Yes. So now, from research, it is being noted that 1 out of every 4 individuals we come across every day has a mental health condition. Yes. So as you're sitting that day now, you can start counting. How many people have you come across today? How in church today, someone was sitting in front of you, someone was sitting beside you, at your back, and out of those 4 people sitting beside you, one has a mental health issue. What mental health? Maybe they think about mental health is okay. When they hear about mental health, they think it's about people that are walking there in the streets, picking stuff from the dustbin or the refuse to eat. No, it's not about the lunatic. It's not about the mad people on the street. I use the word mad. It's not about them. But now mental health is about the people that are wearing clothes like you and I, because it is difficult to really trace from people that are, normal. You see a normal human being, if he or she is suffering from mental health disorder. So mental health is far beyond the people that are walking in the street. Now there are over 200 kinds of mental disorder, starting from anxiety, depression, suicide, schizophrenia. There are so many we can't mention, but the issue is awareness has not been raised about these mental health issues. That's why people are suffering. Imagine in a country like Nigeria, we have over 200 million people from 2006 census, about 200 million people, but yet we don't have up to 1,000 mental health specialists in the country. It's about below 150. And out of those 150 specialists, we have 8 federal psychiatrists hospitals in the country that are functional. Now, tell me how are you going to tackle this issue in a situation like this? So you see, mental health is a big problem. It's a big problem because some people are able to cope with mental disorders, so mental
Are you
stress,
going to see the
while
camera
some
again?
others are unable to cope with mental stress.
What just happened?
Okay,
It's
so
3% off.
there are lots of things we have to say today. But let me just stop here. Let me give chance to the next speaker to say something. We continue. Thank you.
Wow. Thank you so much, Mr. Ifem. That was a great one from you. I believe our audience that are here are hearing and taking down some key points and questions. Okay, now having known what is mental health, and I would like to call in Mr. Henry Femi Ojo to tell us how he feels and manage the experience of mental health. Mr. Femi, you have the floor, sir.
Good evening, everybody. Uh, I cannot say how excited I am to be here. I think from the first speaker, you can know just a little insight of how negligent we are about mental health in the world, and even in Nigeria, which is our closest environment. I I am someone that was diagnosed with bipolar disorder since 2014, and I can tentatively tell you the disadvantages, how it has affected me, drastically affected my life, just from just one random day of fun. You find out that you think every situation of your life from that moment to now. I In 2014 I was diagnosed with bipolar affective disorder. I overdosed on marijuana, and it has been a rocky experience since that time. I When I overdosed, I had a manic episode, and For like 3 months, I was not myself till I finally broke down. And when I broke down, I was referred to a specialist, mental psychiatric ward, and I was there for a month. By the time I came out, I was like a vegetable. So if you go to my Facebook page today, I posted there was a friend of mine that I reached out to. She had a blog, and in that blog, I just posted an experience of a little detail of what it means to be depressed, and that was from my own personal perspective, from my own experience. You go to my page, you see that tall life. It's a blog. I give a little explanation of what it feels like to be depressed, and like one of the speakers here said, for bipolar, it's very dicey because you find it almost very difficult for people to be able to manage the situation because there's two poles. There's a depressive pole and there's a manic. The depressive is excessively depressive. You will be depressed for a very long period of time. It's debilitating. You would not want to do anything. You would not want to clean your. You don't want to do anything. Basically, you just do what you need to move to continue living the next day. Like you just have to eat food because definitely if you don't eat, you would be hungry and you will not be able to survive. So I think the major to keep yourself clean or your room or having to meet wanting you wouldn't want to associate yourself with people, and most times it comes with suicidal thoughts because you find yourself not able to even talk to your friend because you cannot keep a good conversation going. So even if people reach out to you, you cannot reach back. And you're there, even if you want to connect to people, you cannot because your mind is for you to be able to communicate properly. And that was one of the major for me. But I was deliberated for a year. I was just in my room, not doing anything. And let me just say, I spoke to God, and I'm like, okay, if I'm not getting better, I made a vow that okay, if I get better, I'll use the rest of my life to just do something meaningful and purposeful with it. Because I noticed that okay, sometimes friends are just there when things are well, and there's just a few people that will check up on you when even if you're not there, and even if they know that you're sick, and as long as it's a mental issue, some people would not even want to just come and see you or say hi. So I said, okay, if I get better, I'll live my life for people that do not actually need my help. And I'll live a life that, okay, even when I leave this earth, I'll make a mark. And that was what fueled the purpose behind me having an NGO. Now I run an NGO, registered NGO. I partnered with UN Women, Rotary, AU, American University. In fact, American University, we had an MOU. There's Big Family 360. They're also one of the most popular NGOs. They handle GBV, gender-based violence. They have an app that's already going viral in Africa. These are my partners. Last month, I partnered with over 20 different individuals that had registered companies to do an event called Creativity Crunch. And that was my second time celebrating that innovation and celebrating Creativity and Innovation Week. It was announced in 2018, and I was surfing the net. As I was surfing the net, I came across a celebration for Earth Day, which was Innovation and Creativity Day. And that day, there was an announcement made that the UN want people to sit down and see how they can creatively solve world problems. That is the SDG goals. Then there were 17 SDG goals. And I did the celebration, and it was fine. After the celebration, we were having series of meetings. Before you know it, I was having Zoom meetings with a woman called Marcy Siegel. She's the founder of World Innovation and Creativity Day, and they work directly with the UN. That was in 2018. when I finished the celebration, I had a mental breakdown, and I went back to the. I was moved to a bigger facility this time around since, like, the Adama facility couldn't give a good result. Since after that, I still relapsed. I was taken to a facility in Jos, which I think is one of the very popular ones in a quintessential healthcare center. Is in Jos. I can tell you that they were very good at their job because there was one of the things that they called CBT, cognitive behavioral therapy. I can tell you that tentatively that was what pulled me out of depression and made me to be the person that I am now. Because CBT is basically just looking at a bad situation, using the negative energy that comes from the situation and channeling it into something good. So the moment I stepped out from quintessential, I've always had plans to channel the negative energy and bring out something better and stronger from it. I think the moment I came out from rehab, I did something in Jalingo with models. It was they are big with entertainment. So I even did a lecture on cognitive behavioral therapy with the youth then. And I've always had one or two things uniquely and passion to do something new. But funny enough, this year everything just fell in line because I was always scared to do something that has to do with an NGO because once my family hear NGO, they just say, okay, this guy has started going back to his manifest, no matter how good my idea is. And let me tell you the problem with bipolar, it's already known in the world. Chris Brown, Kanye West, all the people with bipolar, they are just different. They are unique. They always think out of the box. And a very big example is the stigma that comes with it. Someone like Kanye West, that he's not just a creative artist, he's also breaking boundaries in fashion. Whenever he has an episode, the world forgets every other thing that he has done, and they just drag him because of his mental illness. Someone that has when it comes to relationships or success or fame, he touches almost everything, but still there's still stigma that comes with bipolar. So with learning that, I just had to know that okay, I'll be very strict when it comes to my mental illness. In fact, I had to change my circle of friends, change where I go to, change the way I work, change the kind of company that I keep around me, just to be sure that yes, my mental health is a priority. Every morning I go for jogging, I go for exercises, and I make sure that I don't take any single thing, anything. I don't take. Before I used to take alcohol because I used to like clubbing. I don't take a drop of alcohol. I don't take energy drink. I don't take cigarette. I don't take shisha. I don't take anything that I know touches my mental health. I'm just a juice, yogurt, water person. I don't do anything else. And when it comes to food, most times I eat just fresh food. So everything I do, it's my health that is priority for me. And at my event yesterday, it was one of the most unique things in my event last 3 weeks. It was one of the most unique things that ever happened in Yola. And when I was registering the event, there are over 160 celebrations around the world. In Nigeria, in Africa, I don't think there were up to 10 that were being registered as an organization, that's an NGO. And there's a space that asks if it's being celebrated by NGOs specifically. If you're just celebrating Creativity and World Innovation Day, it's different than when you're celebrating as an NGO. In Nigeria, I think I'm the only person that celebrated World Creativity and Innovation Day as an NGO. There were 10 celebrations, but in Nigeria, I was the only one that celebrated it as an NGO. And one thing that comes to my mind is there's a lot of innovation and creativity in Nigeria. And I'm like, how innovative are you? Or how creative are you that a day to celebrate innovation and creativity will come and you would not celebrate it? So when the time came, I had always known that I was going to do something big for innovation and creativity. I just booked for a hall. I paid 90,000 before the guest speaker even came. Before I even started talking to him, I already booked for the hall. I
Wow.
just sent him a mail and I'm like, okay, I want to celebrate. And from the pictures from my event with UN Women, he saw that okay, this is an NGO that actually has something concrete that they have done before. And before you know it, he was pressure. I pressured him to. He wanted to attend the event virtually, but I pressured him and changed the date in a way that he could come in before he leaves the country. And he came. To make things bigger, he invited the World Innovation and Creativity Chief Steward, which is Jim Friedman. He's one of the most creative people in the world. He has over 39 Emmy Awards. He's a writer and a producer. This man attended my event virtually. He spoke, he saw the kids. Very unique celebration. So I don't want to even talk about what I did in much detail, but if you go to World Innovation and Creativity Organization, they have a group on Facebook and it's very popular. You will see my celebration there. And the guy who is the Muyiwa Pasakin, who is one of the leading certified creative intelligence coaches in the world, in detail, in quote, said that this is one of the biggest celebrations for world innovation and creativity in Africa. This is an ambassador. He even called me an ambassador before they even reached out to me because he knows that there's few people in the world that will even celebrate world innovation and creativity the way we celebrated it. And we touched almost every aspect. Funny enough, we touched innovation in health, where Dr. Stevens spoke about the innovations they have and breakthroughs they have with tuberculosis and everything. The ambassador told us that since inception, they have never seen a celebration that even touched innovation in health. Most people just do celebrations for creativity, for paintings, for music, and the rest. But this time around, our celebration even touched innovation in health. So that tells you how unique our celebration are. So
Great.
for me, I don't want to even take so much time. I think I've spoken for like 10 minutes. I would let the remaining people have a chance to talk. But one thing I want to say is that once you believe in something, you should go for it, no matter how hard it is, no matter how people don't understand what you're saying. Because in Yola, whenever I'm talking about celebration, creativity, they don't understand what I'm talking about. But for me to have the guts and say, okay, I want to do something, even though no one else believes, it says a lot if you plan to do something to shock the world. Thank you very much.
Oh my goodness, that was a great story and a touching one as well. Thank you so much, Mr. Henry. That was really great from you. Okay, now we all know how to manage, how to feel and manage the experience of mental health. Please, if you're not affected, you are affected. I mean, if you're not affected in a way, you might have someone that is affected in other way. Okay, or you have some or a loved ones that is affected in other way. So, okay, I want to call Miss Joy Batram to tell us how to seek for self-care. So, Joy Batram, you have the floor. Your mic is off. Your this speaker is off.
Can you all hear me clearly?
Yes, yes.
Once more, good
Go
evening,
ahead.
everybody. It's truly my pleasure to be here. Just taking a bit from what the first speaker and the second speaker have said already, I'd like for anyone that knows many number, how much psychologists we have right now in Nigeria to just quickly type it into the chat box, if possible, very quickly. Okay. So while we're still doing that, I'd like to just share a little story. Now, the first time that I found out the number of psychologists we had in Nigeria, I would never forget it because it was just so surprising. I found out that we had 200 psychologists according to the Psychology Association of Nigeria. And when you look at our number, the present statistics puts our population at 200 million people. When you look at that and 200 people, that 200 psychologists, that means for every million of Nigerians rather, you have just one psychologist to cater for them. And that's already, of course, puts us in the red, puts us in a place where we know that, okay, it's not even possible because one person can truly not cater to 1 million people. When you think about, when you really visualize 1 million people like in a hall and then just one person, it's not possible at all. So these are the things that necessitate us actually having opportunities for us to seek self-help. Now, how then do we know which self-help to do? Because to be honest, in our day and age, there is a lot of self-care or rather self-help services that is available. But then how do you sift out which one would actually work for you and which one would not work for you? Now, the very first one, very quickly, that I'd like to share is that the information sources that you're going to be getting whatever self-help from has to be reliable. It has to be from a reliable source. You can't just, type in Google, okay, I'm feeling depressed, what do I do? That alone would not cut it. There are specific sites that can help with this, and a few of them are very well mined. You have the Mental Health America, you have the Psychologists Association of America, and a lot more. In fact, I would suggest that you follow those sites that are linked to developed countries to actually help with that, so that you're not getting information that is just from anywhere and you're using. The second is whatever information you get, they definitely should not be instant solutions, because with mental health is a continuum. And what I mean by continuum is that it's constantly changing. At every point in our life, we are being faced with something. If probably, life itself is in stages. So you find out that, okay, at this point in your life, you're in school and you're struggling with probably your grades and all of that. At some other point, you're married and you're probably having issues with your spouse or something. At some other point, your parents are sick. And all of these things have effects on our mental health. So what this means is that whatever solution that you're getting, it definitely would not be like this. It will not happen like this. It will take a while for it to effect change. Just as Mr. Femi had shared with us, you find out that in a story, he relapsed sometimes, and that is completely fine, because that is how mental health is. You would not expect that, okay, like the way, the drugs we take for our physical health are, you just take a tablet and then, bam, you're cured. Or you have malaria and then you take a drug and it's fine. It does not happen that way with mental health. So whatever help that you're getting, what validates that it's actually quality help is that it's not an instant solution. It's something that you have to work with over time for you to see the best results. In fact, if it's giving you, I don't even think it's possible, but then if it's giving you that fast effects, you should actually question it, because in the long run, it's going to hurt you. Now, since we have looked at, okay, what are the qualities of good health, the next thing is, how then do we access these resources and these tips that would help with our own self-help? And of course, like I said, the first one is using quality sites from the web that would actually help with your mental health. And then the second is support groups. So there are some number of support groups in Nigeria right now that actually help you with your mental health, where you meet persons that are, going through mental health or have lived experiences of mental health, and then you're able to meet with them and share, from your experiences, what has worked for this person, and then you figure out, okay, if this would actually work for me by trying it out. I don't know if I should continue. I should allow the next speaker to come in before I share the last and very important one. Chioma?
You just give you net.
Okay, I'm finding it hard to hear you. Could you please say that again?
Okay. I think we are giving you the next 5 minutes to conclude.
All right then. Thank you very much. So very quickly to round up the second point, which of course is support groups. An example of a support group is Mental Heaven, a an online support group that I co-founded with my co-founder Ngozi Akobundu, who I believe is watching this live on Facebook. And we've had that support group going for almost 3 years now. And it's basically we as persons that are passionate about mental health and are also in the health field trying to make accessible information to persons that are living with mental health disorders, persons that are probably, just have issues with their mental health. Like I said from the beginning, if you remember, mental health is a continuum. So it's like a spectrum. You can be at, say, for instance, zero. It's think of a number line from 0 to 10. So someone that probably has bipolar will be at probably an 8 or a 9, and then you that is probably just going through some stuff at that point in time to be at 2 or 5. So what we do is we try to link up persons in every area of this spectrum to help that will be able to actually help them. Finally, my last point is online free mental health counseling services, which would be, because we don't have as much psychologists in Nigeria, luckily we have persons that are passionate about the well-being of Nigerians. I mean, we have beautiful, beautiful persons in Nigeria that really do care. And these people have somehow figured out a way to train persons that are interested in helping, volunteers that are interested in helping, and making them, arming them with the necessary tools and education that they need to be able to help other people. And we call them mental health counselors. So there are a number of organizations that have these mental health counselors, and some of them even go as far as actually hiring specialists, which are psychologists, that would be able to help you. Now, I'll be going through them, and I hope that this will be pasted on the live. The first is Mentally Aware Nigeria Initiative. The second is Psychobabble Foundation. The third I have here with me is Anti-Suicide and Depression Squad. And then finally, and then the only paid one on my list is Google Health. Google Health is something that you can use on Simply Pay. As I said, it's paid, so you'd have to like subscribe the same way you subscribe to your Spotify. You subscribe to Google Health, and then you get to actually speak with a mental health counselor rather, and psychologist. For the other ones, they are simply free. All you have to do is reach them through their, then you're being linked with a mental health counselor. So in conclusion, just to take it from the top, what qualifies self-help? What qualifies quality self-help? Number one is the fact that you are getting it from sites that are not, just opinion based. It's not from someone's social media post because they feel, down at that point in time, and that's what comes to mind. Number two is that they are not instant solutions. They are not solutions that are just, like this and you get better. Then, where can you get this help? Where can you get this help that you need? The first is from support groups, and the second is from free online mental health counseling services. Thank you very much. I'd accept and contributions. Thank you.
Thank you so much, Miss Joy Batra. That was a very wonderful speech from you. And because of time, I will be calling Miss Joy Anthony to tell us how to go ahead with self-care. Miss Joy, you have the floor. Miss Joy Anthony, you have the floor.
Okay, good evening, everyone. Good evening, all my speakers, everyone watching online. Good evening. Hope you had a great day. As every speakers have said, they have spoken on the importance of mental health, how mental health is important, and how important it is to prioritize your mental health. So now I'll be talking about how we can take care of ourselves. Like Ms. Joy Bertrand spoke on how to seek help. But before seeking help, you need to take care of yourself first to prevent any mental health illness or challenges that can affect you. So we all have mental health, and it is important for us to take care of ourselves. When we feel stressed, overwhelmed, or burnt out, we start to neglect the basics of looking out for ourselves. Looking after yourself is an important coping strategy. It's a very important way of coping so as to prevent any mental health illness. So self-care is about you meeting your basic needs so you can be physically and mentally healthy. Once you are able to meet your basic needs, you prevent and protect your mental health. Self-care is the practice of taking care of oneself. It takes purposeful and intentional effort, but it can help with maintaining or improving your daily well-being. It is very important to know that self-care is not a selfish act, and it does not have to be time-consuming or expensive. It just has to be simple daily habit to take, or daily things you do daily. Like you wake up in the morning, you brush your teeth, you eat, you take your bath. That's how self-care is. You do basic, simple things, but in this aspect, you are taking care of your mental health. So sometimes the term self-care is misused. It is used and misunderstood to describe things you want to buy, like a manicure, getting your nails done, or smoothie, like all these your cravings. They call it cravings. That's not self-care. You're not taking care of your mental health. You're taking care of you're satisfying your urge. You're just satisfying your cravings. These things are pleasant, but they don't necessarily add up to self-care. Self-care is made up of activities you do daily and consistently. Self-care helps reduce anxiety. If you find a personal means of self-care, it is important. It will help you and maintain a positive mental health. There are several self-care routines that you can adopt and practice on a daily basis. The most important self-care routine is sleep and rest. If you practice healthy sleep habits and listen to the needs of your body, you will be able to maintain and protect your mental health. A lot of us don't you see some people sleep by 2 a.m. Once you sleep, you need to practice very good sleeping habit. If you sleep for like 6 hours in a day and improve it continuously, like there was a time I could not sleep till it gets to 2 or 3. That's when I'll be able to fall asleep, and it will affect your mental. You feel stressed. You wake up in the morning and you'll be very stressed and tired. You'll be asking yourself why you are this tired when you just woke up, because you did not sleep early, and it might not affect you immediately. It might not affect you immediately, but it will definitely affect your mental health. Another self-care routine is exercise. Research has shown that regular exercise increases a chemical called serotonin level, which in turn improves your mood and energy. Once you wake up and you exercise daily, every day, it will improve your mood. There are some people who will wake up, there are people who go through depression or anxiety. You wake up in the morning and you are sad and moody, and you'll be moody all through. But once you wake up early and you exercise, it has a way of increasing your mood. It will increase your mood. Just you will even be surprised at how energetic you feel that day. So if we practice good sleep routine, practice daily exercise, it will help your mental health. Other self-care routine you can practice are mindful meditation. Mindful meditation is meditating daily, mindfully. And there are several ways to meditate. You can meditate anytime, in the morning, in the afternoon, at work, in school. Just pick a quiet place where you're quiet and without distractions. There should be no distraction. You just relax your mind, free your mind of every thought. And our mind is like a marketplace. Our mind is like a marketplace with different thoughts running about. It's never it's never steady. So if you want to meditate, you make sure you relax your mind. There should be no thought. Just imagine yourself, picture yourself closing doors in your mind. As you're closing those doors, you're closing doors of every thought in your mind, and you feel relaxed and calm. And you do that daily for, like, you can start small, 2 minutes, 5 minutes, and then you go on to 2 hours, and you see how it will improve your mental health drastically. You can practice creative expression like writing, painting, drawing, photography, listening to music. The main aim here is to channel your emotions through art. If you are someone who likes writing, you enjoy writing. Whenever you start feeling down or you start feeling sad or you feel your mental health is deteriorating, you just pick up your journal and you write. Just write and express your emotion, express yourself. If you cannot write or you don't like writing like me, you paint if you are good in painting, or you draw, or you take pictures, or you listen to music. Just look for a way to channel that emotion. Don't let it be inside you. Don't let it build up, because once it's inside you, it will build up and lead to something else. All these mental illnesses like depression, anxiety, bipolar, they start small. They start from somewhere. Once you start letting those emotions build up inside you, it will lead to something that it will be very difficult to overlook. Another way to self-care is to meet and hang out with friends. Once you are always alone to yourself, you're always alone and in a quiet place, you're always alone, it will affect your mental health. And that's where you start getting, once you're sad, you don't have anybody to talk to. You start having all these suicidal thoughts. So once you start feeling sad, or you know that your mental health, something's affecting your mental health, just go out, meet your friends, hang out with friends. If you don't have friends, you have family. Even if there are some family or some people that don't show love, they love you. So just go out, meet them, hang out with friends, just talk, do everything, but just make sure that you don't concentrate on what is going on in your head. Appreciate nature, like go out, take a walk. You can go to a field, go to a park, just take a walk. Eh, just walk around, appreciate nature, look at the little things like butterflies, flowers, all these other things, and look at them critically, analyze them, appreciate them, and your mental health to thank you. Do something for someone. Another way to protect your mental health, to take care of yourself, is to do something for someone. Make somebody else happy. If you are sad, you can look at someone who you feel that person is happy, make that person happy. And once you see the smile on that person's face, there will be a feeling of joy and fulfillment in your heart. And you'll be happy that you made somebody happy. And once you're happy, your mental health is happy too. All these things are some of the self-care routine you can adopt. There are little things, all these little activities you can do that can help your mental health. When you practice self-care regularly, you become more productive. Your self-compassion will be improved. You become more productive. You see that when you feel lazy to do things and you practice all these other self-care routines, you feel energetic and productive to do the things you are supposed to do. Self-care helps you discover who you really are. If you're someone who likes writing and you start, when you feel sad, you start writing, and you now discover that you are really good at writing, and you can maybe create a career out of it. Almost everything will work again if you unplug it for a few minutes, including yourself, including your mental health. If you're using a charger, for instance, and you notice that your charger is faulty, once, or let me use the common one, batteries, your remote control batteries. If you notice that your remote is faulty, and you just move the batteries and you plug it in, you put the batteries back in, you notice that it starts working. The same thing with you, humans. Once you are feeling down or depressed or sad, just take a break from everything. Take a break from your activities, your work, your job, your school. Take a break for like 2 hours and relax. Self-care, clear your mind of everything. Take care of yourself, take care of your mind, and you see that you become more productive. It is not selfish to love yourself. Take care of yourself and make your happiness a priority. It is not selfish. It is very necessary. So I'll conclude by saying, please, you should carve out time today and take care of yourself. Start again, make it a routine, make it a habit to take care of yourself. Thank you.
Okay, thank you so much, Miss Joy Anthony. That was really a great one from you, and that was really a great one from you. And for that wonderful presentation, that was very nice. So before we go ahead, we have hands that is being raised. Mr. Femi's hand is being raised, and also we have 23 questions already to be asked, to be answered. So, Mr. Femi, you have the floor to say what you want to say. Thank you.
Yes, funny enough, I can relate with almost everything that most of the speakers are saying. Here in Yola, I got to meet someone that has something called Your Ally, which is a partnership from a psychologist in the US. There's a platform online and on social media where you can go and book an appointment, an anonymous appointment, and you could get to talk to somebody on the phone, or you could meet someone physically to talk about your mental health. And I'm already thinking of partnering with them to do something that a lot of people can come together and just in a safe space, where people can come together and talk about what they are going through. Just the way there are 21 questions waiting, I think it would be more effective if there's a place where people can come together and feel safe to talk about what they are going through. And it's something that I know I'll plan on doing maybe by next month. And Mrs. Anthony Joy, I like your enthusiasm and the tips that you give. They are very, very insightful. Like me, I know I use music a lot, and music helps me. That's why I even subscribe for Spotify, because I know that that's what helps me to go through my day. Whenever I'm stressed, whenever I feel anxious, I just play music. And like you said, unplugging battery. Whenever I'm tense, I just leave whatever I'm doing and go and have a nap. Sometimes I call it power nap. Even in the afternoon, if I feel stressed, I will just shut down, go and sleep, even if it's for 30 minutes. You wake up refreshed. And I hope that, yes, we'll get to talk more after this meeting. Thank you.
Thank you, Mr. Henry.
Thank you, Mr. Henry. So go straight to the questions. First, the question is going to you, Joy Bartram. I would love to hear from you. How does one handle mental health in illness? Yeah.
Could you please take the question again, the last part of the question?
Okay, the question is, how does one handle mental health illness? Okay, mental illness. Yeah, mental illness.
Okay, so my advice for someone that wants to manage a mental health illness is the very first thing to do is to get a diagnosis. It's very, very important, and it's not as hard as people think it is. You don't actually have to go all the way to a psychiatric hospital. Your normal doctors are being trained at least to be able to diagnose a mental health illness. And then from there, you can now start looking at, okay, how important for you to get help. Like I mentioned with seeking help, it's not a one size fits all thing. The skills that would help you with ADHD, which is attention deficit hypersensitive disorder, hypersensitivity disorder, to treat that they're two very different things, and of course they're going to need personalized help. And then even individually, when it comes to mental health, people are being treated based on their individuality. Patients are being treated, or persons living with it are being treated based on their individuality, not just a one size fits all thing. So you first get a diagnosis from a doctor, then you meet a therapist to help you further work out these problems. And therapy is not okay just for persons, like the way we see it in our society, for persons that are crazy or mad. It's not like that. Therapy is for everybody. In fact, if you can afford it, it's something that everyone should have. So you start with therapy, and then from there, both your therapist and your doctor would work together to ensure that, okay, what dose of the medication, now we're talking about a pharmacist even coming in, what dose of the medication would you be on that would help you? And of course, you would have to adhere to the dosage of the medication. It's very, very important. You cannot be on meds and now decide, okay, because I'm ashamed, which, because some people can actually not be kind, but for your own growth and for your own care, like Joy spoke about, prioritizing your mental health, and Mr. Femi talked about prioritizing his own mental health to the point of cutting some friends off. That's the same way too that you treat yourself, with utmost priority, that if it means I'm taking drugs, it does not matter who is around me, I will take those drugs. If it means me putting, reminders on my phone to ensure that I take those drugs, of course, by all means do that. So first off, meet a doctor, then you see a therapist, and then those two in conjunction with your pharmacist would write out a treatment plan that will be best suited for you. I hope I answered that.
Okay, thank you so much, Miss Joy. That was a great one from you. And I want to appreciate our audience that is watching, and I want you guys to ask more questions, please. So I'm going to ask the second question to Joy Anthony. Okay, Joy Anthony, I would love you to tell us what can one do to, what do you say to a friend who pays too much attention to things that could easily depress them?
Okay,
Joy and
thank you. Thank you, Miss Choma. What can someone say to a friend that pays too much attention? Once you notice that you have someone who pays attention to things that could easily depress them, and you are trying to help that person, you talk to the person, you speak to the person, make the person understand the effect of what he or she is doing. Make the person understand how it's going to affect their mental health. Once you speak to the person, and maybe the person is, there are some people that are very stubborn and will not want to listen to you. You try helping the person your own way. You take out the things that the person focus on. If there are physical things that can be removed, you take it out. If let me give an example. If the person is seeing things online that easily depresses them, you can take the person's phone. If it's a page that the person is following, unfollow that page for the person. You are doing it for the person's good. Help the person take out the things. Before you do that, speak to the person and let the person know how this is, whatever he or she is doing will affect their mental health. And once you see that it has already affected their mental health, just look for professionals for the person that will help talk to the person too. Yeah, I hope I've answered that.
yeah, you did well. Thank you so much, Miss Joy. And to you, Mr. Femi Ojo, I would like you to tell us, we'd like to hear from you if anxiety is a mental health illness.
I can tell you that for bipolar and anxiety, they go hand in hand. Almost anything I want to do, especially when I want to have an event, there's a build-up of anxiety. The closer the event comes, the more anxious I become. Till it gets to a point that I just want the event to come and pass, so that I will just be able to become myself and rest. There are times that you become so anxious at night that you cannot sleep, and sometimes in those situations, there are some people that I just talk to, and they help me ease out that situation. I have people that I confide in and say, okay, I can't sleep. How I need to talk to you, and there are people that actually help. They are there for you. If you don't have those kind of people, I think maybe you try and do something just to distract you, like listen to music or try and just get up from the bed, just do something. But anxiety is definitely, I believe, is part of one of the issues that people, especially with use of social media. I can say that social media these days it's becoming so much pressure that's put on people to be anxious, to want to be successful, and just makes you feel like you don't have self-worth or you're not doing anything. And people forget that social media just shows you the side of life that people want you to see. Just because you see someone living a bubbly life, you don't know what is going through behind closed doors. No one's life is perfect. So we should try and minimize what we expose ourselves to on social media. You should try and look for channels that will help build you on social media. Utilize social media more. Look for motivational pages, look for business help pages, look for pages that will actually use your data to help build your person than just looking at lifestyle that is mostly built on unrealistic expectations. Thank you.
Okay, thank you so much, Mr. Henry. So back to you, Mr. Fiongo. Sorry, I'm sorry for pronouncing it wrong. So how do one let go of depression, Mr. Fiong?
I think
I
it's
don't
not.
think he's. I don't think he's not online.
Yeah,
He's not online.
maybe ask the next question.
Okay, the next question goes to you, Joy Bertrand. Okay, what are the possible causes of mental health issues? Joy Bertrand, you have the floor. Please, we don't have much time, so we should be fast about it. Okay, thank you.
Sorry, I missed your question. Could you repeat it? Thank you.
Okay, my question is what are the possible of mental health issues in children? Did you get me now? Did you get me, ma?
Now I can hear you.
Okay, I repeat again. My question is what are the possible causes of mental health issues in children?
Okay, so for children, it's actually wide range, though you would not expect for it to be so, but then a major factor is how the mom took care of herself during pregnancy prior to giving birth to a child. So in fact, it's backed up by statistics rather have shown that a mom that has a mental health illness, it's actually very, very possible for her child to come up with the same thing right from, you know, right from when they're giving birth to. But then, of course, symptoms would only show when they become a bit older, say when they're toddlers, like from 3, 4, and all of that. But aside from genetics, there's also environmental factors such as stress, the kind of homes that they're being given birth to. So if they have things like domestic violence going on, emotional abuse going on, that in itself could also serve as a risk factor to children getting mental health illnesses. Another is lack of having a balanced diet. So all in all of these things work together. It's not caused by just one thing. When you have all of these factors together, it makes the child to be much more at risk. Not also forgetting early exposure to substances. What do I mean by substances? Cigarette smoke, hard drugs, alcohol, and the likes of it. So when a child is being exposed to these different things, there is a very high risk of them developing mental health illnesses.
Okay, thank you so much for that, Miss Joy Bertrand. Okay, my question, next question goes to you, Joy Anthony. What? Oh, okay. Are you hearing me now? Okay, the next question goes to you, Joy Anthony. What are the causes? What causes emotional distress?
Okay, thank you for that question. Emotional distress is let me explain it first of all. When you feel physically stressed, you go out, you work from morning till night, and your body is tired and you're stressed. Then now change it to your emotions. You listen to maybe you are abused emotionally or listen to things that affect your emotions. You now become emotionally stressed. So now what causes emotional distress? Yeah, there are things we listen to. For instance, if you are emotionally abused, maybe you have someone that you're working very hard to prove to this person that, or you're working very hard to make someone proud, and the person does not appreciate you. The person is always saying you're not good enough, you're not working hard enough. All those things will make people's emotion to be stressed out. Or you're trying to prove to someone that you love them or show love to somebody and they are not appreciating it. When people are not appreciative of your efforts, all those things will lead to emotional distress. So yeah, things people say and things we watch or things we see that we don't like are the things that causes emotional distress. Yeah. Sorry, we cannot hear you. We can't hear you.
hear me now?
Yes, yes.
Okay, so that was a good one from you, Joy. Coming down to Mr. Henry. Shit. Okay, can you hear me now? Okay, that was a good one from you, Joy Anthony. Coming down to you, Mr. Henry. So the question is mental health only for people who are mad in the streets?
As you can see, I think I'm a tentative example. If I don't open my mouth and tell you that I have bipolar, I don't think you can ever have the slightest idea that I have a mental illness. So I think that is already answers your question without even me opening my mouth to say anything else. And I have tentative experience in that because people don't understand. They see me and they just say you just hate people. You just go, you don't look for people. It's only when you need to do something you just come out and bring people together, and later you hide again. So people don't really know what you're going through. It's like you're just wearing a mask, smiling, or you go to social media, you're always posting jokes. Most people that are posting jokes on social media, you find out that funny enough, they are the ones that are going through depression. People are laughing from their posts. They don't know that they themselves are going through so much pain. So it's not just people that are mad on the streets. In fact, it's more of the people that are off the streets that need the mental health, if you ask me. Thank you.
Okay, thank you so much. That was a great one from you. So the question comes back to you, Joy Bertrand. How can one manage stress? Please let's make it fast, and we don't have much time again. Hello, can I be heard, John Bertrand?
Joy, Joy Batra.
No, we cannot hear you. Chama, we have questions on Facebook. You can check your phone to say those ones as well.
Okay, ma.
Joy Bertrand, please go ahead.
Joy Bertrand, please go ahead.
Question.
Is it?
I did not hear your question at all.
Okay. Sorry. The question is, how can one manage stress? How can one manage his stress?
That question is everyone has something that causes them stress. And in a perfect world, the best way to manage stress, of course, would be to remove what is stressing you. But sometimes it's the very things that we love, it's the very things that we. So how do you rather manage stress on a day-to-day basis? First off is realizing everything is within your control. Because most times with stress, it's us thinking about things that are actually outside of our control. So we have to individually, come to terms with the fact that, to be honest, there are very few things that we can control. And majorly of what we can control, or the majority of things that we can control, is our own actions. Other people's actions will definitely stress us. So you're looking at things like, okay, your boss is not seeing the good thing that you're doing in work, or maybe your grades are failing, and it's not that you're not. All of these things, it's really the fact that how other people are responding to us that is causing us stress. We're able to realize and come to the truth, because it's very easy for you to post it online that, oh, focus on what you can control and forget about what you can't control. At every point in time, at every day, if you ask yourself whenever you're stressed, is this thing within my control? And you honestly answer that question, that would help inform you if it's something that you should, continue to pursue, as to, okay, I need to get better at this, or it's something that you should let go of. Now, that is one major way of letting go of stress. Another way of letting go of stress is by sleeping. Good old sleep. No matter what we say, like no matter how stressful your day is, something that is a major indicator for most kinds of mental health illnesses is the amount of sleep that we get. You talk about anxiety, depression, and the rest. If you're able to get enough sleep, trust me, even your physical illnesses would not disturb you as much. So prioritizing sleep, eating well, because I know we've all heard of this adage, you're what you eat. And it's literally that we are what we eat. If you don't eat well, there's no way you would function well. If you even take a test on your own self, you find out that when you eat really good food, the energy level is different from when you're just anyhow and you're just eating anything, as the day comes, you wake up, you don't even eat anything in the morning, and then you just remember that, oh, I've not eaten today, then you just grab something. It's different from when you actually have a balanced diet, complete with fruits and rest. Another way of managing stress is, like Mr. Femi had shared, exercise. Though it seems like exercise stress you, but they stress you in a good way. It's the good kind of stress that your body actually needs. So when you do exercises, and I don't mean once a week kind of thing, daily, say 30 minutes of your day, 15 minutes, even 15 minutes of you consistently doing exercises daily would help you manage stress better.
Okay, thank you so much. That was a great one from you, Joy Bertrand. I really appreciate. So back to you, Joy Anthony. This will be the last question for the call. So the question is, what role does our esteem plays with regarding to the fighting depression? Like how is it possible our self-esteem helps us fight depression? How possible does our self-esteem help us fight depression? Over to you, Joy Anthony.
Okay, thank you. First of all, let me explain. Self-esteem is how we view ourselves, how we value ourselves, what we feel our worth is, what we feel we are worth. That's what self-esteem means. So how self-esteem affects depression? Is that the question? How self-esteem affect depression?
Yes.
Okay. Okay, depression is a feeling of a long-term feeling of sadness. And if you have a very high self-esteem, your self-worth is very high.
Sorry to cut you. It's not affect. How does it help us fight depression?
Okay. Okay, how it helps us fight depression. Self-esteem can help us reduce the rates of depression or reduce how depression affects us. So if your self-esteem, if you have a very high look at yourself, if you look at yourself like you value yourself very highly, it will help you um fight depression in a sense that if you're feeling sad and you are depressed and you feel I don't want to go out, I'm sad, maybe nobody loves me, I'm just indoors, let me just stay indoors and keep on being sad. And once that feeling starts coming with your self-worth, with the way you value yourself, you feel like, no, I cannot do this, I cannot stay indoors alone, and maybe there are people out there who need me, people out there need to hear my voice, people out there need to see me, there are people I'm inspiring out there. So if I keep on being sad and acting depressed, I'm not only affecting myself, I'm also causing harm for other people who are looking up to me outside. So once you value yourself, you place yourself really high, it will help you fight depression in the sense that you want to go out, you want to fight that feeling of depression, you want to fight that feeling of sadness, so that people will see you and people will know that yes, you know what you really want, you know yourself, what you know, how to value yourself. So once you have people with low self-esteem, once you have low self-esteem and that feeling of sadness comes, you'll be like, okay, I'll just be indoors. After all, there's nobody out there who is looking at me. Nobody is watching me out there. Nobody cares about me. And once you start feeling that way, it will add to your depression. It will add to it and increase it. So once we have high self-esteem, it will help us fight depression.
Okay, thank you so much for that wonderful presentation. And thank you so much to our audience watching live from Facebook, and to our speakers for giving us the answers to the questions. So right now I'll invite our executive director to conclude this season. Thank you. Over to you, ma'am.
Okay. Hi everyone. Yeah, like this has been a very exciting session. I've just been nodding my head, like I think maybe I have a mental health issue because most of the things everybody was mentioning, I think I'm a victim because I don't know how to sleep. If I mention everything you've said, like I've really learned a lot personally, and I really want to appreciate the entire amazing speakers that are mental health advocates. I mean, people don't talk about these conversations every day. People hardly have access to this information. You might think people are aware, but I bet you it's not about them going to school. Many people are not even aware of this level of information that you've powerfully shared here. So really want to say thank you to you all. And we're sorry that we cannot take all the questions. There are many questions that came from a survey that the young people who are mental health advocates pushed out on social media, and we got about over 50 questions or so. We're able to sieve out to get 23 questions so they don't repeat themselves, right? But because of time, we can't take all. But then there's a good news how we're going to address all those questions. The remaining questions that have not been answered, we will type it and put it as a post, and also invite our speakers to probably just go there and add their answers or response to those questions, so people can always still get the answers that they were looking for. And everyone watching, you can feel free to reach out to any of these speakers. I mean, they are all on Facebook. I mean, with the internet age of that we have right now, you can access anyone at any point in time. Just google their full names. Just google their full names on the internet, and with that, it will take you straight up to their platforms, even how to find them, and then keep boxing them, ask them questions and get the right answers that you're looking for. And Joy Bartram, I would like you to share with us those platforms you mentioned, right? Like as a comment on the live session, so people can always go back and either reference you or see that, oh, Joy said this is where I can run to for help. Thank you so much. Thank you so much. Thank you so much, everyone. And for everyone that joined, we hope to do this again in several topics, in the organization as time goes on. We believe in the power of young people. We believe that they have the solutions, they have the ability to make the changes that we all desire to see. I mean, if a young person is accurately informed today, all these issues we are trying to address and solve, you will see that we can grow up into adulthood and have limited or reduced of this problem existing. So we encourage everyone to join hands with us or with anyone out there that is working with young people to ensure that we are providing the right information to these young persons. They are not too small to have access to the right information. As long as, even if they are from ages 3, find a way to inform a young person from their growing age before they get to the adulthood, trying to find themselves, trying to get the right information, and see themselves repeating the same mistakes. So at this point, I'll say very big thank you, everyone. I wish we could stay longer. I wish we could stay longer, but unfortunately, we have to go. Everybody was actively participating in the comment section. I mean, we see you all. We see you all. So I'll just quickly, maybe run down, give a shout out to some names that I'm seeing here. I mean, shout out to you all. To show you that we saw your comment. Moyi Nolua Shonubu, please. Sorry, I'm murdering your name, but shout out to you. We saw you. We saw your comment, your contributions. Makbe Augustina, thank you. Mina Emmanuel, House of Princess, we see you. Thank you so much. Ketura, she's also one of the mental health advocates, and she was just here, and she was contributing as well. Thank you so much. We see you. Messi Owuji. Oh, Nigerian languages are interesting. Thank you so much. We see you. We see you, and we see you. Who else? Ajang Precious, shout out to you. Shout out to sorry, I'm going through the names, but don't worry, everybody needs to be appreciated. Olalekan Babayo Day. Thank you. Elkazi Al Eli. We see you. Thank you. Maxwell David, we see you. That's another mental health advocate. He was also here and also contributing as well. Ubong, Akpekong, everyone, Stanley, Ishaku. I mean, thank you so much. Thank you so much. Everyone, have a great night. So we come your way again next time, next month. TFT has promised to be bringing young people your way every month to be sharing with you informations that everyone needs. So don't forget to always stop by and share as you learn. Last action point from us is, as you listen to this live to this point, do us a favor, just go and share the link, or just go and share this live so someone else can also get this information that we all heard today. Thank you all. We love you all. Thank you. Thank you, our amazing moderator, Choma. It was amazing. Thank you so much for taking us through all the whole journey. Thank you, Jerry Batcham. Family Development Initiative. Boss. I mean, your story is, nobody has an excuse anymore, because despite what was happening to you, you were still holding on to what you really want to do. When you come out of it, you're still on track, and now you have an amazing story that you are now going to motivate every other person out there. Thank you so much for sharing. It was really, really like insightful and helpful. And Tony Joy, this one, she's already like a doctor in the making in mental health psychology issues, so she's already studying a course in line with that because of where she has passion for. So we look forward to the amazing mental health doctor they are going to become. I mean, we should not have mental thank you. Don't understand, had network issue fluctuating, but then that was our public health person that also shared in the beginning what mental health was about. So you see, young people are getting themselves involved in this career paths, in these conversations, and we're all here to support each other. Having said this, good night, everyone. Have a great day. Have a great night. Have a great week. See you again. Bye. Bye. Want to end the life. How those